Hi, my name is Jenny Morrow, and welcome to our channel where Bryce and I talk about all things personal development, self-development, and especially relationship development from a variety of angles, perspectives, methods, and models. Today, I'm going to talk about the difference between therapy and coaching. I'm going to talk about the difference between the two. I'm going to talk about what is not different between the two. I'm going to talk about my own experience professionally as someone who's been both a coach and a therapist. And I'm going to talk about my experience as a client of both therapy and coaching. So let's dive in. First, I'm going to talk about the difference in the what between coaching and therapy, and then I'll talk about the difference in who coaching services and who therapy services. Therapy is a medical treatment, and it includes assessment, diagnosis, and medical treatment. Coaching is a self-improvement process aimed at a specific goal. It includes teaching, mentorship, and/or guidance in an area of development and is designed to help a client improve in or excel at a specific area or in a specific and desired outcome. You could think of a weightlifting coach, a piano teacher, or a yoga instructor. These are all examples of different types of coaches. Let's talk about the who. What is the difference between who therapy services and who coaching is designed to help? Therapists are working under HIPAA, and all clients or patients are considered to be a potentially vulnerable population. Coaching clients, on the other hand, are considered healthy enough to effectively engage in the process of self-improvement or self-development regarding whatever goal or area of expertise they are working to excel in. In coaching, clients are also considered stable enough to advocate for themselves and their own needs. Often, a good coach would be able to recognize if that is not the case. So, for example, if you're a dance coach and someone has a leg injury, hopefully you would be able to be attuned enough to realize that if you're teaching a certain type of dance move, this person doesn't seem to be able to do that without pain. That would be a good indicator that what they're actually needing in the situation is not dance coaching, but medical treatment, or perhaps some kind of medical therapy to help them resolve the injury or the pain enough where they could dance effectively and safely. Now, this is not always the case, as some clients are very good at hiding their areas of pain or what they're struggling with. So sometimes coaching clients don't show up honestly enough for a coach to be able to recognize if there is a problem. But in a lot of cases, and often, a good coach will be able to see if there's not progress or something seems to be blocking it, then they may encourage medical assessment. And this is the case when you're working with a personal development coach as well as, for example, a health coach or a business coach or some other type of coach. Now, some clients will work with both a therapist and a coach. So someone might be working with a personal development coach and have a therapist, or they might be working with a business coach or a relationship coach and have a therapist. So in certain situations, a coach can help assess whether or not they can engage in the coaching process while under the supervision of a therapist. Another area of difference in therapy and coaching are the payment options. In therapy, there's the option of paying with insurance or perhaps your health savings account. Now, that's not always the case. In order to use insurance, there often has to be a diagnosis, and not all clients either need a diagnosis or want a diagnosis, as many people do go to therapists for coaching support. So as a therapist, I often worked with clients who didn't actually want or need a diagnosis, and we weren't actually doing medical treatment, but they came in for some kind of emotional support. And in that case, without a diagnosis, insurance would often not cover. But if there is a diagnosis, then insurance and or health savings can often be an option. Sometimes health savings can be an option, even if there is no diagnosis. And then sometimes there are things like employee assistant programs, or certain schools will offer access to discounted therapy as well. And then therapists can also work with private pay or self-pay clients. In the field of coaching, the only payment option is self-pay or private pay, though there are some employers who will also cover coaching. But generally, it's all self-pay, private pay, and someone is stepping up to cover that cost, whether it's the client or someone else. Now let's talk about some things that are actually not different in therapy and coaching, though sometimes these are spoken of as the thing that is different. My perspective is that these things aren't necessarily different, and I'll tell you why. Again, the main difference between therapy and coaching is just specifically that therapy is a medical treatment and it can include medical assessment and diagnoses, which coaching never will. So one thing that people sometimes say is different that I do not believe is different from my experience of therapy and coaching is that some people say that a therapist works with the past and a coach works with the future. When I worked as a therapist, my goal was to help clients to get the emotional outcome and relational outcomes and life outcomes that they wanted to get. It was to help them to live healthier, happier, more productive, and fulfilling lives. If that meant going back into the past to work out something that was still with them in the present emotionally, then we would do that. I didn't necessarily see a reason to go back into the past unless it was somehow connected to a present goal or something they wanted to accomplish in the future. Now, this might be why I was drawn to coaching from the very beginning, because that was always my perspective, even as a therapist. And now, working specifically and exclusively as a coach, I generally don't go back into the past for the same reason, unless there's something that needs to be seen or spoken about or acknowledged in order to get what someone wants in the present and as they prepare for the future. In that case, if there's something important to mention, then they might mention that so that we can adjust whatever's happening in the present so that they can accomplish more of what they want to in the future. If a client mentions something from the past that needs medical treatment or that's still with them and is manifesting as something that needs medical treatment, then I will refer them out to a therapist. But in my experience, therapy and coaching can both acknowledge the past, present, and the future. Another thing people will often say is a difference, but I haven't experienced it as a difference myself, is long-term versus short-term. So often people will talk about therapy as being a longer-term process and coaching as being a short-term process. But in my experience, it really does depend on whatever the main goal is and whatever type of approach the therapist or coach is using. So for example, when I began training as a therapist, the model I was initially most interested in was called solution-focused therapy. And solution-focused therapy is designed to be a short-term therapeutic model. There are also some therapeutic models that orient around a long-term orientation, such as psychoanalysis. When looking at coaching, the same is also true. Certain types of coaching processes, orientations, and goals will be focused on short-term work, short-term process, and short-term goals. Other types of coaching will focus on long-term goals. For example, I had a piano teacher while I was growing up, and I consider her to be one of my musical coaches. And I worked with her for many years while I learned to improve and develop through different levels of piano advancement. The same can be true of a yoga teacher that you may work with for many years while you improve your ability to engage new poses and move through more advanced layers. The same can be true of a business coach, and the same could be true of a life coach or an emotional coach. There are certain types of coaches who can help you to develop through different levels of improvement and development. There also can be coaches who help you with something just in the short term. Perhaps you need a coach to help you rewrite your marketing plan. And so you hire a business coach that can help you specifically do that. It's a short-term goal. They help you with that goal, and then you might be done. So it really does depend more on what the client is looking for, what the coach has to offer, and what the goals are that you're working to accomplish. Another area that people say is different, but I often see is not necessarily different, is people will say that therapists work in the unconscious and coaches work in the conscious. And in my experience, again, both types of people can work in either. The orientation is more, what is the goal? And what is it that the client is seeking to progress in, work on, fulfill, or in the case of medical treatment, what are they working to heal and resolve? So for example, even a golf coach might help their client to see what they're doing unconsciously. So they might take a video of their client and help the client to see what they're doing with their body. The client, that might not be in the conscious awareness of the client until they see the video and have the golf coach actually point out what it is that they're doing and what actually could be done differently. So a coach can absolutely help bring things that are not in the client's awareness to their conscious awareness as something that can help them to improve. And a therapist can very, very much work in the conscious awareness. Now, one thing that I didn't really learn as a therapist that probably would have been nice to know is that there are many, many medical conditions that can lead to mental health illness. For example, if someone has vitamin B6 toxicity, that can create a lot of anxiety. And so someone might go into therapy wanting to get help for their anxiety, not knowing that they actually have a vitamin toxicity, for example. And in that case, no matter what the therapist does, it might not resolve the client's anxiety. What they're doing is not really effective. The client might say therapy just doesn't work. The therapist might think this client's just not working hard enough, when really the case is that the anxiety is actually sourced from a physical medical issue that, unless it gets resolved, the emotional experience might only change in very small ways or really may not change at all. That's one of the disadvantages with therapy, is that therapists are expected to be working in the medical model, but they don't actually have a way to medically and objectively test things. So most therapists don't have the required degrees or the required trainings to do things like testing hormone balance, testing chemical balances, testing brain function. And so, again, therapists are working in the medical field, but they don't have a lot of resources for medical testing. And coaching can also have similar issues at times if someone is trying to coach someone to do something, but there's actually something standing in the way that has nothing to do with the coaching process. For example, someone might have a mental illness, or they could even just be neurodivergent. So there could be something like ADHD present, and the coach is trying to help them to schedule their life better, or they're working on time management, and they can't quite figure out why this client just seems to be so resistant, or seems to not be able to get it right, or seems to not be in the normal bell curve of what they've experienced with clients. So in these cases, it can be difficult if the coach doesn't have some training to at least check in when, okay, if this isn't working or there isn't progress, there could be something else going on that needs to be looked at. And it might be helpful to refer them to a medical professional, refer them to a doctor or a therapist who might be able to help find out if there's anything else that could be blocking the improvement or the progress. Now, both coaches and therapists can work in a niche or in a specialty area, and many do. So while there can be a general life coach, often coaches will specialize in areas such as business coaching or relationship coaching, which is what I do, what my husband does, and what we do together. There can also be health coaches, music coaches, athletic coaches, spiritual coaches, financial coaches, and so on. And that's also the case with therapists. Therapists can specialize in specific areas as well. So when I was trained specifically as a marriage and family therapist. And while I worked generally with many different types of issues that were both individual issues and issues within couples, there were some areas that I didn't work with at all. So for example, I never worked with children as a therapist and rarely ever worked with teenagers. Another area that is not different is that both therapists and coaches can be good at their job or not good at their job, or anywhere in between. Both therapists and coaches can be ethical, not ethical, or any area in between. Now, while therapists are working under the ethics of the medical field and have some of their own specific ethical guidelines, both therapists and coaches are subject to the law, and if they do something illegal, they can have charges brought up against them. As far as my own experience in the coaching world and in the therapy world, it was about 20 years ago when I started working as a career coach for medical assisting students. At that time, I went through one of my first coach trainings, which was on visualization and visioneering. I was also trained in how to administer the Enneagram assessment, specifically to help people better identify what area of work or what career might be a good fit. Not long after that, about 2 years later, I began my training and my study and my work in marriage and family therapy. Over the last 20 years, since I first began training as a coach and then as a therapist, I have done many coach trainings and many therapy trainings. I've learned a variety of coaching models and a variety of therapy models. And it's really from all of that experience and all of that learning, and then sitting in over 15,000 sessions with clients, that I ended up developing my own model. And what I found was really helpful for the type of clients that I wanted to work with and for the type of development that I was most interested in, helping people to learn about and improve on. And that really is in the realm of relationships. Specifically, I was very, very interested in how to help people in the area of what I call intimacy development. Intimacy development meaning being able to better know oneself and develop a deeper, more connected relationship with oneself, as well as do that out in the world. So be able to develop a more intimate, more real, more honest relationship with the self, as well as develop a more intimate, real, and honest relationship with other people, with one's career, with one's experience of their body, and so on. And what I found in my work was that I really loved the coaching process. I also found that as a client of both therapy and coaching, I ended up being more drawn to being a client of coaching than I was to being a therapy client. It just was a better fit for me as a client, and it really ended up being a better fit for me as well as a professional. So just to give you an idea of what it can look like, generally my experiences in the client seat with therapy were with my supervisors, were with therapists who were actually supervising me and supporting me in my work as a therapist. And what I found is that when I wanted help with a specific something, I would generally go see a coach that helped with that area specifically. So for example, I worked with dating coaches in my early 30s, which really was so helpful for me understanding the dating process more and understanding how to adjust my mindset and my approach and the actions I was taking to be more in alignment with the type of relationship I wanted, which I think was really helpful in helping me meet and find Bryce. I also worked with a somatic emotional processing coach, and I found it extremely helpful. So that really motivated me to go out and learn a little bit more about somatic work and to learn more about the body-mind connection. A few years ago, my husband and I were also in the midst of trying to decide what to do about the baby decision, which really means, do we have a baby or not? Do we adopt? Do we go through foster care? And so at that time, we ended up meeting with a coach who specialized in helping people make the baby decision. I also had yoga instructors who are very helpful in wellness and health coaching. I've also worked with relationship coaches. So when my husband and I started dating and we got together and we moved in together, one of our agreements at the time was that we would start meeting with a coach. He had a personal life coach. I had a personal life coach. So what we did at that time is every other month we met with his coach and every other month we met with my coach. Since then, we have also worked with a variety of other relationship coaches. Since this is a profession for both of us, we are really interested not only in studying and learning from the viewpoint of the coach, but we've also been really interested in having the experience of being clients. The other area where I've worked with coaches is in business coaching. Since I've owned my own business now for 10 years, and since Bryce and I have gone into business together, we've been really interested in having business coaches to help support us in developing our business in a way that feels aligned with what we really want to create. So whether you're looking for therapy or coaching, I hope this has helped to give you an idea of what the differences are, what the similarities are, and I hope it's helped to give you an idea of what types of support there is out there. I think both therapy and coaching can be extremely helpful. I think it depends on where you are personally. I think it depends on what you want. And I think more than anything, finding the right fits to help you create what you want can be a bit of a journey, but I think it is really possible. So I'm sending you all lots of luck in finding the perfect fit, whether you're looking for therapy or whether you're looking for coaching. If you're someone who actually really enjoys helping people and you're interested in getting trained as a coach and specifically as a relationship coach, my husband Bryce and I are currently getting ready to offer a relationship coach training. It will be starting in June of 2024. If you're interested, I will add a link in the description below where you can find out more about the coach training. And this can also be a great fit if you're already a therapist or a coach and you want to learn a relationship-oriented model that you can add to the models that you already work with or add to your tool belt. So whether you're just someone who likes to help friends and family, whether you're already a therapist or coach, if you're interested in learning more about the model that Bryce and I use in our own life as we work on things, the model that we use with our clients, it's also going to be the model that we're going to be teaching to our trainees. So if you're interested, check out that link below. I'll put it in the description. Be sure to subscribe to the channel so that you never miss a video. You can also sign up for our newsletter, which will also be linked in the description below, so that you can get lots of support in your relationship life. Sending lots of care, and I will talk to you soon.